most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I also think by the way, have the largest nose.
Oh,
I
the
quite
old
a honker.
schnoz.
Yeah. Today we're going to talk about we need your help.
That's
you
right.
Subscribers. We want your best advice for knee replacement surgery.
Particularly if you've had one personally.
If you haven't, I don't really want your advice. I mean,
Well, if it was your spouse or your parent, they might be.
Right. Or if you're a therapist, if you want to give your best advice. But, Brad and I have started another tagline. We're trying it out, see how it fits. So life is hard. Let's help each other.
That's right.
Very simple. So get in there and get comments below, what people can look out for with knee replacement.
Share your experience and help others out.
Share and share alike.
That's right.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. And if you're wondering why we have this mattress here, we're giving away a free mattress this week. So you go to Bob and Brad, go to the giveaway section, sign up. This is not the entire mattress. It's just a sample of a mattress so you can see what they look like. We actually have a cutaway here, and it shows the 700 individual mattresses.
Tiny little mattresses.
With air channels.
Yep, keeps it cool.
Very comfortable. You can also find the contest. It'll be on Facebook. Another reason to like us on there. It'll be pinned at the top of the page. Go to Instagram, Twitter, or TikTok if you want a 60-second version of the program where we don't ramble on and on.
That's right. We have podcasts out there now. You can listen to us while you're driving down the road, get educated.
Or working out.
Or working out. That's another thing. Yes, absolutely.
So.
Oh, we're not done?
Yeah. Well, we're done. Yeah, that's the match. Okay. Thank you, Brad, for doing that. What? Okay. So for those of you who are considering knee replacement, we're going to give our advice, our best advice. We'll start with it, okay?
And I got to say, between the two of us over the last 30 years, I'm sure we've done worked with thousands of total knee replacements. I always enjoy working with total knee replacements. They typically work out well, very high success rate, and people are very appreciative, and it's fun to see them limp in with a crutch and walk out without one.
Yeah, it's, you can think of the cases where it went bad. I count them on one hand almost.
It's very
rare. Yeah. So that's really our one thing we want to say is don't wait too long, because as you get older, your health may not allow surgery, and it gets tougher to deal with as you get older.
Right.
So I know we're not pro surgery by any means, Brad and I. In fact, we try to try other things first.
Right.
But there are some things where you can let it go too far, and it's very hard to recover then. My grandpa waited too long to have hip surgery, and then he couldn't have it, and he couldn't walk then.
It may not be it could be because of the joint itself may not have the integrity, or maybe you have heart problems, or you have diabetes, or some other medical problem which your body won't accept or tolerate the surgery itself. So.
Number 2, keep the knee, the leg as strong as possible. You want to do this before the surgery and, of course, after the surgery, too.
We call that prehab. Before the surgery. And I can't emphasize that enough. I know Bob feels the same way. If you can get the knee moving as much as possible, get the muscles as strong as you can within good reason and safety, it's going to help your post-hab, your rehab after surgery.
If you want to just type in exercises for Bob and Brad for knee exercises, and they'll pop up, or knee replacement exercises.
Right.
And now
we have the whole series on it.
Whole series on it. You also want to make sure you strengthen the hips, because the hips really will affect how the knee works.
Yep.
And it will throw it off, actually, if the hips are weak.
And they're not very complicated exercises.
No, very simple. We're going to show you a little bit of strengthening exercise. The next one is, and one of the renowned surgeons on this made this statement, Brad. He said, it's a fight against scar tissue. When you get the knee replacement done, it's a time contest against scar tissue, because scar tissue is forming in the knee, and you want to get the knee moving before it gets laid down too intense to the point where you can't move the knee.
Right, because the scar tissue will just scar up. If you didn't move your knee at all over a period of a couple of weeks, it would get extremely stiff.
And it'd be hard to get bending and straightening as much.
So yeah, you typically the next day after surgery, they're
You're
moving
getting
it.
things moving.
Yep.
So Brad and I are going to recommend that you're going to try either the FitGlide or the knee glide. The knee glide is really just for one leg, and it works fine after you had knee replacement. But what's nice about this, you can actually use this prior to surgery and after surgery. Now, when you go in this way and you got the little handle here, I'm actually going to put that up like this, and I go up, I'm actually working my quadricep a little bit more.
Mm-hmm.
Now, this doesn't seem like much, and it's not too much, but if you keep doing it for a while,
Right.
you'll feel it.
Right. Yep. I'm just working with someone right now. He's actually getting a knee replacement. He's using the FitGlide, but the knee glide, works well too.
I'll show that.
Yeah. Then you get his other knee has got some issues too.
Right, and that's when you keep both healthy. Then.
Right.
So you can also just have it flat, and you can also have it reversed. In which case, you're now working the hamstring a little bit more.
Right. Now this
you feel more.
Yeah. This you want to don't get too aggressive on it so you get a hamstring cramp, but just pay attention to it.
I think the huge advantage of this, Brad, is how lightweight it is.
Right.
I mean, you can take it with your little finger and do curls with it.
Now, the thing is, and you can put a dish rag or towel on a smooth floor, and it works. It doesn't work as good as this, but it works if you don't want to buy one of these, which is fine. But if you're on carpet, this works great. It's hard to get something you can put a plastic bag down.
And you can't obviously go on an ankle when you have a rag on the floor.
Right. Yeah.
So, and you won't look cool either.
Well, you're more apt to do your exercises when you have a nice piece of equipment.
So the FitGlide, just very simple. You're going to get both legs at the same time. And what's nice about this, Brad, I think you would agree, is that when you're done with rehab, you can use it just to exercise underneath your desk, or you know what I mean. You can continue to exercise.
Right. Yep.
You can watch TV. You can.
And even for if there's people that are homebound or just have really bad arthritic knees that can't have surgery, this can be one of the go-to exercises to keep those joints moving. To keep. Bob. Oh. Yeah, so with the FitGlide, if you can't have surgery, this will be
a good alternative because
wow, that was good segue. Yeah.
No, I mean it actually. I would try this before surgery because it might prevent having the need for surgery.
That's possible.
Yeah,
depending on how bad it is. Yeah.
But the other thing is you can use this in bed.
Oh,
you can actually lie in bed and work your leg. You can get it moving.
Yeah.
And the same with this one. Right after surgery, you can get things going.
Yeah, because they don't use CPMs, those big fancy machines with the electric motor on it. Well, a few do, but very few. This is better because you're activating muscles as opposed to have something push through that knee.
By the way, this is lightweight too.
Holy cow.
What'd you do?
Oh my goodness.
Brad,
I broke the bed.
We almost had an accident where we could treat something afterwards. All right, next piece of advice, Brad. Let's move right along here. I would say don't try to be brave and tough out the pain. Take enough pain medication.
You mean after surgery?
Yeah.
Yeah.
I've seen people who have said, I don't want to take pain medication, and their rehab suffers because of it. I mean, I'm not saying go crazy and keep on it forever. You have to get off it. But you have to control the pain enough that you can do the rehab, or it's not going to do any good.
Yep. Talk to your surgeon about that. Let them know you want to get off them as soon as you can. They'll work with you.
They want to get you off
right.
as soon as
absolutely
possible. It's, the opioids and narcotics.
Yes. They're a problem. They can be.
All right. The other one that I've seen a lot, including my mother-in-law, she was using a cane, and then she stopped using it because it was doing better.
Yep.
And she started limping again, and the pain was increasing. Don't get rid of the walker.
She probably wanted to get rid of it because she didn't like the stigma of using a cane. Yeah.
Right. So don't get rid of if you're using a walker or crutches or a cane, don't get rid of it too soon.
Yeah.
You want to make sure you're really solid. One, we don't want to fall.
Yeah.
And two, you want to make sure that your walking is normal and that you're not limping.
Forming a bad habit.
The pain can come right back when you get rid of the cane too soon. So I got two more here. One, pick a surgeon who's done lots of knee replacement surgeries. That may sound like stupid advice, but they've done studies on this, and the surgeon who does the same surgery over and over again obviously becomes better at it.
Right.
I mean, it just becomes, they've experienced all the problems that could occur. And if you're a guy that's doing knee replacement surgeries, shoulder surgeries, hip surgeries,
right.
I mean, they still might be good, but I would still go with the guy.
Yep.
I used to work at the Mayo Clinic, and they had a guy there that he just pounded out these knee surgeries, but he was so good.
Yeah.
But he would do it was amazing. Like he'd do 8 a day or something like that. I mean, it was crazy. Yeah, he put in long hours. He just was like a madman.
Well, those surgeons are pretty.
Yeah,
it's a personality.
Yeah, it is a personality type.
Yeah, that's a good thing because that's what we need.
Yep. Last one is, don't get too caught up in how fast or slow your knee is recovering.
Do not talk to other people about their experience because they'll.
Well, we want other people to give their experience.
But if they're negative people, just shut them off because there are people that are going to. It happens. And then people say, well, I talked to my friend Susie and her knee was bending 120 degrees at 2 weeks. Well, that happens occasionally, but
also people don't have very good memories. They think their knee was bending better than it was, or they forget how much pain they were having.
Listen to your therapist; they'll set you straight.
If you have one knee done and then another later, I will tell you they will be different. I mean, one's going to probably do really well, and one may not do well. It's just that's the nature of the business.
Yeah, absolutely.
So, all right, do you want to add anything else, Brad?
Well, Bob.
We can fix just about anything
except for
a broken heart.
That's right. And we cannot segue this knee thing into the heart thing.
No, they're not connected.
Yeah.
Peace.
Be careful.
Out.